Hello, I'm Dr.Rakesh currently pursuing my DNB residency. I'm doing second year now. Uh, After getting a decent rank in NEETPG, I was thinking about what branch should I select, like ENT, Ophthalm, anesthesia, and other branches like pathology also I was getting. But basically I wanted a clinical branch which was full of medical spice and some surgical spice also, because I wanted to do some procedures with my own hands. So first of all, the branch which I was getting was Ophthalm. So this branch was only having surgical things, but it was not having this medicine and all. And ENT also was like that only surgical things were there. So coming to anesthesia, it was having the medicine things and the surgical things, like we were getting to do all the procedures like intubation, central line insertion, IV cannulation, and arterial line. So there were many stuffs we were getting to do, and it was full of emergencies. So it was full of nice stuff for doing, and it was never a boring thing to do. But like other branches like medicine, surgery, it was specified for their branch only. But in anesthesia, we were getting the spice of medicine, surgery. So it was a very good decision. So before, when I got my rank, like 20-30,000 between, so I was very upset. But after like what branch should I take, what will be good for me? But after taking anesthesia, I was, for initial period I was like, what should I do, what will happen? But after a period of 1 year, 1.5 years, I was really very happy, and I was never regretting my decision.
So, what do you think about aspirants getting in doubt about DNB versus MD? So, which one should they choose? Is one better than the other, or is there anything like that?
So, coming to a debate of MD versus DNB, basically there are three aspects we have to look for, like hands-on. First is hands-on, second is the patient load, and third is academics. So these three things are the basic things which a residency is completed. So to MD, these three things are important, like cutting, patient load, and the academics. And in central DNB also, these three things are important. And coming to the comparison between the central DNB and the peripheral MD, these three things you are getting in central DNB much better compared to the peripheral MD. So better going to the central DNB only in metro cities if you are not getting MD in central metro.
So you are telling that if I'm getting a DNB in a DNB institute which is in the central part, such as in a metro city, then it is better to choose DNB there rather than doing a MD course at a periphery hospital where the patient load or the academics might not be very great. So that is what your point is.
Yeah, always you can go with the central DNB, as I was also getting MD.
Okay, by central you mean that the metro cities of DNBs which have good patient
of
load.
the respective state you are getting.
Okay,
So
understood.
better going to the metro city part of for getting your DNB rather than going to the peripheral MD, because I was also getting my MD in peripheral parts, but I chose to the metro DNB, the central DNB which I was getting in metro cities, and I never regretted doing that thing. Because many people were saying that why you have choose DNB over MD. But I was getting peripheral MD, where after so much of like I was checking out whether which hospital is good and patient load, because I wanted mainly to do the cutting and all, and patient load was very important aspect in my residency, and academics also. And
So after doing anesthesia residency, so how are the options, work options, how are the super specialty options? So what is the future of a resident who is just passed out from anesthesia? What have you seen in your seniors, and can you share something
you are talking about the opportunities
Yes.
that we get. So there are lots of opportunities that we get. Like there is a branch called pain management we
Okay.
can do. It's a course of 1 year. They are doing really good in that branch. And there is another option like critical management. There is a course named IDCCM. It's a course of 1 year fellowship. So that you can pursue. And another branch is the outdoor procedures that we do, like MRI, CT scan, endoscopy. There also they require anesthesia. So there are many opportunities. Like you can do super specialty also. There is an exam called NEET SS. So you can adopt that exam. You can apply for that exam after your residency, and you can do many super specialties like onco anesthesia, then transplant anesthesia is there, and cardiac anesthesia is there. So there are lots of opportunities that you will get. It's a never-ending branch, actually, to say, and I will never regret my decision of taking anesthesia, and I'm very happy doing my residency.